Recording. Okay, perfect. And then now I'm going to share. Okay, can everyone see my screen?
Yes.
Okay, perfect. All right. Everybody, thank you so much for coming here today. Today, I'll be discussing BMI, but really, we're going to go beyond BMI. We're going to talk about what your body composition really says about your health. So, before we get into this presentation, just a little background about me. I'm Dr. J. My full name is Dr. Janika Benoit. I'm a dual board certified internal medicine and sports medicine physician, and I struggled with obesity as a child. So, to your left, you can see me right here. This is me as a kid. And really, during my adolescent years, because I had struggled with obesity so much, I really got involved into fitness and sports, really as a way to first lose weight. And then I also started, watching my diet as an adolescent. And I realized that, okay, well, if I'm fit and I monitor my diet, then I can maintain a healthier weight. And so that is when just my love for fitness took off. And so actually became a personal trainer while also studying to get into medical school. And then after medical school, I went into my internal medicine residency at Queens Hospital Center in Jamaica, Queens. And then I went to get my sports medicine fellowship. Um, now, as a practicing physician, when I got into my mid 30s, that was really the heaviest I've ever been. And this is me in the middle, in the orange dress, which was the heaviest I've ever been. I also developed high cholesterol for the first time ever. And really, prior to my mid 30s, my LDL cholesterol was always normal. Um, and also at the same time, I was working in an obesity medicine telemedicine practice. And I realized that a lot of the struggles that some of the women were telling me were very similar to the ones that I was experiencing. So I was always thinking about food. I was always hungry. Nothing would really satisfy me. And really was happening during this time, in my mid 30s, I was going through perimenopause. And really, what happens during perimenopause, your genetics start to become unmasked. So things that you did not experience prior to perimenopause, it starts to be unmasked during your perimenopausal period, which is from your mid 30s, early 40s. Given my family history of cardiovascular disease and, given what I knew as a physician, I knew I had to change my health trajectory. And so that's exactly what I did. I started learning more about nutrition. I started learning more about fitness, in particular as it pertains to women, because our bodies change very differently than it does than it compared to men. And that's what led me to find my telehealth practice, Invessel Health and Wellness, in 2025. And that's me now. Holla, praise Jesus, hallelujah. That's how I look now, after learning more about all the things that I was helping my patients with. All right, so this is an answer that this is a question that we're going to answer throughout the duration of this presentation. If BMI was the answer, why do so many women still feel stuck about their weight goals? And these are just some of the things that we're going to talk about as it relates to BMI, why it falls short, and a much better metric to use, which is body composition and how that's measured. All right, so this is why BMI was never meant to define your health. So first we have to talk about, where does BMI even come from? BMI stands for Body Mass Index, and it was actually created in the 1830s by a mathematician. And it was created to study population averages to see what the average man looked like. But it was not used as a metric to really hone down on individual health. Your body mass index is really composed of only two things, your weight and your height. Okay, so it's your weight in kilograms divided by your height in meters squared. And so these are the categories, and you see it goes anywhere from underweight, which is less than 18.5, to what is considered obesity, which is greater or equal to 30. Now, why does this matter? This matters because sometimes I noticed when I was talking to my patient and I asked them what their goal was, they would always tell me, okay, well, my goal is to lower my BMI. But really it's misleading because BMI is used as a screening tool and it's really not a diagnostic or outcome measure. And I'm going to explain more into this presentation. You'll see why. So these are some of the ways that BMI is used. It's used to classify obesity, which I showed earlier. It's used to determine health risks. It's used to decide eligibility for medications like GLP-1s. And also, one thing I didn't add is also used to determine eligibility for bariatric surgery. Now, this is the issue because the BMI is indirectly related to body fat. It doesn't tell you how much fat you carry. It doesn't tell you where that fat is located. It does not tell you how much fat you have in proportion to muscle. And most importantly, it does not tell you your metabolic health. It does not tell you how at risk you are or at how less of a risk you are for measures of metabolic health. Those things being type 2 diabetes, high blood pressure, stroke. It cannot tell you that information. Now, here are some examples to just hone down the point even more. So we have two people. We have Miss A and Miss B. Miss A has hypertension and she has what is called a normal BMI. So that is anywhere from 18.5 to 24.9. She is within that category. Now, she has more body fat and less muscle mass than Miss B, who is in the overweight category. And Miss B does not have any metabolic disturbance. So that means she does not have high blood pressure, she does not have type 2 diabetes, she does not have a history of stroke. Now, the thing is, Miss A has what is called normal weight obesity because Miss A, even though her BMI is normal, she has a metabolic disturbance, which is hypertension. Versus Miss B, she has an overweight BMI and no metabolic disturbance. So this shows you that two women can have the same BMI in very different health profiles. In one instance, somebody has a normal BMI, but they have a metabolic disturbance, and then another person has what is called overweight and no metabolic disturbance. So the BMI really falls short. It does not give you the full clinical picture because your BMI can be normal, but you still have comorbidities like high blood pressure, which can lead to cardiovascular disease. So here are the major limitations of BMI for women. And this is further on why BMI just misses the mark. Because BMI can vary, right? It can vary based on your age. It can vary based on your sex. It can be vary based on your ethnicity. And this is extremely important because the same BMI should not mean that you have the same treatment plan. Everybody should be individualized because there are so many variables involved. Now, again, this affects care because this leads to a less metabolic risk assessment and that impacts how you're treated. On the contrary, there is something called body composition. Now, body composition, this looks at what your body is actually made of, not just your height and what you weigh. And there's a long list of what your body composition can measure, but ideally, the first two things body fat mass and the skeletal muscle mass, that is my priority when I'm looking at anybody's body composition. But it can also give you your body fat percentage. It could give you your segmental lean analysis, which compares your proportion of fat of your upper body compared to your lower body. It shows your total body water. It shows your intracellular to extracellular ratio. So it shows to see, okay, if you have more water outside of the cells versus inside the cells, you may be having more inflammation. Sometimes that is a marker for certain diseases like heart failure. It can look at the visceral fat, which is the fat surrounding your organs, which is also a risk indicator for metabolic disease. It looks at your dry skeletal muscle mass because what happens, our muscle, especially when we're working out, gets filled up with water and stored sugar called glycogen. So that's kind of a wet skeletal muscle mass. So it'll show you your skeletal mass without water and glycogen in it. And then your segmental fat slash fat distribution, which is essentially what I mentioned earlier, the proportion of body fat compared to your upper body compared to lower body. Now, here's another comparison. We have Miss C and Miss D. Now, they both weigh the same. They both weigh 160 pounds. Now, Miss C has 60 pounds of muscle mass. Remember, I said on the body composition, I look at two things mostly. I look at a lot of things, but first is the skeletal muscle mass and the body fat mass. So Miss C has 60 pounds of skeletal muscle mass, 47 pounds of body fat, 30% body fat percentage. So, based on these markers, because she has higher muscle mass compared to her body fat, she has better insulin sensitivity and hence better metabolic health. And this lowers her risk for metabolic disease, okay, like type 2 diabetes, high blood pressure, stroke. On the contrary, Miss D, she has 40 pounds of skeletal muscle mass, 54 pounds of body fat. So she has more body fat than muscle. She's at 45% body fat percentage, and she struggles with fatigue, blood sugar regulation, and therefore has a higher risk of metabolic disease. So the point is, both of these women weigh the same, but their body composition is different, and therefore they have different risk factors for metabolic disease. And this is something that the scale or the BMI cannot tell you, but body composition can. And this is important because it changes the way that we treat you essentially. Because with this information, we're able to change your nutritional strategy, change your exercise strategy to help put you in a more favorable body composition. Okay, and this just furthers the point even more is that body composition, it really reflects the things that you need to know. It reflects real health drivers. It helps you determine, even with the body composition, I can tell about your nutrition. I can tell about your physical activity, about your genetics. And this is important again because it plays a huge role in metabolic disease risk assessment. All right, so I actually love this slide. Because there are actually different body types. Okay, so you see these three body types. The woman to your left is what is called an ectomorph. Um, and even before I get into the different body types, your body type is influenced by your genetics. Okay. So, and that's why weight management can be, sometimes complex and tricky because depending on our body type depends on our genetics. Okay. And depending on our body type, which is influenced by genetics, you may need a different strategy to help put you in a more favorable body composition. So, ectomorph. An ectomorph, a woman who has an ectomorph body type, this is someone who's naturally thin. Okay, they have a slim waist, they have narrow shoulders. You probably had a friend when you were younger, who they could eat everything and they could not gain weight, that's an ectomorph, okay? All right. Versus a mesomorph. A mesomorph is someone, their body type, they more have a more defined waist, broad shoulders. They actually gain muscle very easily. Okay. An endomorph is someone who has a more fuller waist and they actually can store fat very easily. Okay. And so actually me as a kid, I actually was a combination of two body types. And the three that I have remaining, you actually could be a combination of two body types. And I was a combination of two. I was a mesomorph, but I was also an endomorph because as a kid, I was obese, right? I showed you a picture of what I looked like when I was younger, and I had to work really hard to maintain um, a fit body, right? And then it caught up to me once I hit my mid 30s, but I had to work really hard to maintain a fit body. So that was my endomorph body type. And then once I started working out and really monitoring my diet, I was able to bring out my mesomorph body type. So I'm a combination of an meso endomorph. And so just think about it. Like think about your body type. Think about um, how you were as a kid. So sometimes we have to go back in our childhood and think about, okay, like was it easy for me to gain weight as a kid? Like was I able to eat anything I was that I saw and not gain any weight? Was I more muscular growing up? Was that a combination of two? So this is really important to know what our body type is because it influences how I look at body composition and how I determine what strategy is best for a patient. So this is how body composition is measured. So the gold standard to measure body type is a DEXA scan, and this is what you see on to the far left. DEXA scan is also used to diagnose osteoporosis. However, sometimes, you don't have this machine in your home, right? It's not, always easy to get to this machine. You probably need to get an order by your clinician in order to get a DEXA scan done. So sometimes it may not be very easily accessible to get done. Then you have a bioelectrical impedance analysis or scan, and that's what you see in the middle and to the right. Now, the one in the middle is one that you would have in the office, okay? And the one to the right is one that you would have in the comfort of your home. And so it's nice to have those two options because they're much more readily accessible. You could either have this done in your doctor's office or even have your own within your home. Now, like I said, the numbers that I look at when it comes to body composition, the main ones is your body fat mass and your skeletal muscle mass. There's also your body fat percentage, which I will look at to elucidate more information in your visceral fat, which should be less than 10. Now, you may be thinking, oh, well, what should my number be? What should my body fat percentage be? And so there's really no perfect number. And like I said earlier, the goal is number one to have if someone's body fat is much higher than their muscle mass, then my goal is to equalize them. At least get the body fat equal to the muscle mass. And then my goal after that is to get the skeletal muscle mass greater than the body fat mass. So that really is the goal, because everybody's body is different. Like I said earlier, everybody's body type is influenced by their genetics, and based on that, we carry for fat different than other people. So really, we can't only look at the body fat percentage, but we have to look at the body type, which is influenced by the genetics, and then look at the skeletal muscle mass and body fat mass to see if you could at least equalize them. And then the ultimate goal is to have a skeletal mass be higher than the body fat. And so we want to shift to sustainable health because once we do that, once we are maintaining muscle mass or increasing muscle mass or reducing body fat, we are able to improve our metabolic health. And that is the goal because cardiovascular disease, it is the leading risk of death in women. And this is what we want to do. We want to make sure that we are creating favorable body composition to improve metabolic health outcomes in our community. All right, so now we're going to put it all together. So this is a body composition report, and this is a body composition report from an InBody Dial H3O, which is embodies the brand, and this is a home model. So this is a home a body composition bioelectrical impedance scan, and I circle where I want you to focus on right now. So I said the first thing that I look at is the skeletal mass and the body fat mass. So to the left. This report was taken on December 9th. Okay, so this person's skeletal muscle mass was 58.4 pounds and the body fat mass was 53.6 pounds. The following month, you saw that the skeletal muscle mass increased by 3.6 pounds and then the fat decreased by 6.2 pounds. Now, just a caveat. I said earlier, when we are working out, our muscles become inflated with water and glycogen, which is stored sugar. So, according to this body composition, I can look at it and see that that 3.6 pounds is likely a little bit skewed. So, I would take half of that. So, about 1.8 pounds, I would say that person gained in muscle in a matter of a month. And then the body fat mass, it really doesn't have much variability. So that patient likely could have had a 6.2 pound fat loss because they were doing all the things. They were really focusing on the nutrition strategy and focusing on strength training. Um, and so, but I want you to look above those two numbers. Guess what? The weight stayed the same, generally the same, right? 156 pounds. It stayed the same. But you see that within a matter of the month, that patient got into a more favorable body composition. And I'll let you know that this patient is actually me. This is my body composition report. Okay, this is my own body composition report. So my weight stayed the same. So if I was just looking at my BMI, right? I said your BMI is your weight based on kilograms and your height, meters squared. My BMI would have stayed the same. Okay. It would have stayed at, it's pretty much the same, right? You see, my BMI is the same, 28.6, right? So I'm what is considered overweight category. But my body composition says much differently, right? Especially within a matter of the month. I was able to improve my skeletal muscle mass. I was able to drop my body fat mass, and therefore I have um, decreased my metabolic health risk factors. And also because of that, I was able to drop my LDL cholesterol too. Because like I said, that was in my mid-30s, which was 2024. My LDL cholesterol was the highest it's ever been. So I was able to drop my LDL by about 50. Okay. And so this is what we look at to assess our metabolic health. And this is just putting everything that I've, stated in this presentation. All right, so I'm going to give you some homework to do, okay? So, InBody is the brand of the bioelectric impedance scan that I use, and I really like it. It's very favorable in the health and fitness community because it measures electrical impulses through your body fat at a much wider frequency than other brands do. So, I want you to Google InBody near me, okay? And I want you to go to one of those sites and get your own body composition report because I think it will elucidate a lot of information to see like where you stand in terms of your body composition. And I want you to just look at these three metrics, okay? I want you to look at your skeletal muscle mass. Oh, I put it twice, but your skeletal muscle mass, your body fat mass, so that's a typo. So look at your skeletal muscle mass, your body fat mass, and then look at your visceral fat and see if it's within alignment. Because if your skeletal muscle mass is higher than your muscle mass, then your visceral fat should be less than 10. So let me just look at my report again. So you see in both instances, my skeletal muscle mass was higher than my body fat mass, so my visceral fat is less than 10, which is what's considered favorable. It actually dropped to 7 the following month. So I want you to look at that. Your skeletal muscle mass, your body fat mass, and your visceral fats. Okay? So you can just Google in body near me, and then you should, at least have a baseline of where you stand. And that way, if you go to your doctor and they're complaining about your BMI, show them your body composition. All right. Now, if you're interested in diving deeper, then I have a telehealth practice. It's called Invessel Health and Wellness. Um, and I am licensed in multiple states. I'm licensed in multiple states in the South. I actually should have put a list here. And then I'm also licensed in multiple states in the Midwest. I think we have Georgia, I'm licensed. New York, I'm not yet licensed. Connecticut, I'm not yet licensed. But if you're interested, in joining the practice, I can easily get a state license. It's very easy for me to get a medical license in different states. So if you're interested in diving deeper, and having a consultation call, then you can take a picture, uh, take a scan the QR code. If not, if you're already on your cell phone, then Josh, can you drop the link for that?